Hi, Phoebe. Great job on your presentation. I am so impressed with just how jam-packed it was with information. Very well done. Um, you really covered how prevalent it is and how important of an issue is for anyone in healthcare, and kind of how it is caused, the pathophysiology behind it. Very well done. Um, just a couple things that I might try to improve on for next time if you're looking for things that you want to continue to work on for presentations. Um, there were a couple slides that had some like statistics on them, some facts that didn't have any citations. So maybe just making sure to include citations on all of them would be great, just so everyone knows where the information is coming from. I know a lot of this stuff is things that we just know because we know it from nursing school and just from our experience, but throwing some citations in there from a textbook or from a study can be useful. And then obviously the length, it was a little longer than it was supposed to be, but mine was too. It was really hard to keep it down to the 15 minutes. So that's something that we both could try to work on. Um, and then the only other thing was maybe you could try putting like your notes for your presentation like just under your camera or just above your camera, somewhere where you could see them easily, and then we could have more like eye contact with the camera, because there were a number of times where like you were looking off to the side and like you spoke very well and very clearly, and you just had so much great information. So it's not like you could just like memorize all of that for every slide. So somewhere where you could read it easily and still look back and forth to the camera often would be great. It would really help to draw in your audience even more. But seriously, other than that, amazing. I think you went into the perfect amount of detail. It wasn't overwhelming. It was just what we needed to know about the issue. And the other thing that I really liked that you did is that you included your personal stories. I like that you talked about your dad, that you talked about that 29-year-old patient that you had, that had to be amputated. I think we've all had diabetic patients that we've seen, maybe not in as dramatic of a case as you said, but we've all had, I think, those patients that haven't been compliant and they're in the hospital dealing with something because of it. And it's always really hard to watch. So I really appreciated that you drew in those personal experiences, because that's why we do this, is to take care of these patients and hopefully make their lives better. I really like that you focused on the non-pharmacological aspects of this, because this really is, of all the things that we see and treat, this is one of the ones that we really, as human beings, can do a lot for ourselves. We can, do better with our eating habits, with our exercising, and all those things that will first of all, hopefully help us prevent from developing type 2 diabetes. But even if we do develop it, it can help us keep it under control. So I think that was huge and really necessary that you included all of that. And I think you covered it well and really included all the important points. So great work. This is hugely important for all of us in every aspect of nursing, I think. So great choice of topic, and you covered it really well. And thanks for sharing with us.